The effects of action potential stimulation, or APS therapy, on pain in people with multiple sclerosis, a randomised placebo-controlled trial. This is my research proposal as part of my MSc Bioresearch in the format of a Pecha Kucha for the University of Bedfordshire. So pain is a problem in multiple sclerosis, and depending on what source you're looking at, its prevalence is between 63 and 84%. That people with MS will have a problem with pain. 9 types of pain have been cited by Truini et al. As part of MS, and in particular, central neuropathic pain is a problem in MS and causes a huge amount of impact on people's quality of life, relationships, work, mobility. One of the key problems to treating a neuropathic pain in people with MS is that the tricyclic and anticonvulsant drug groups that we commonly use are associated with a lot of difficult side effects, including things like sedation, weight gain, dizziness, and other problems. So for the past 5 years at the MS Therapy Centre where I work, we have been trialling a microcurrent electrical device called action potential stimulation therapy, primarily used for pain, and we've been trialling it with the group of people with multiple sclerosis that we work with. APS therapy both simulates or copies and stimulates the action potentials, which is the burst of electricity which travels along a nerve cell or a muscle or endocrine cell to transmit information in the human body, and has a very particular role in the transmission and perception of pain. Robust research on APS therapy is very scant. Some papers have been published in the 90s and in the early 2000s, but are not particularly robust and are not necessarily searchable on good quality search engines. A paper, the last good quality paper published was in 2015, which was a randomised controlled trial pitting APS therapy head to head with interferential, and both were noted to have significant results. However, only 10 treatments were used, which in my experience is a problem, as there are many people who are slow to respond. So we kept the data from our first 2 years of treatment and presented it as a pilot study. We noted pain reduction, but also improvements in people's fatigue or improved energy, sleep, and other measures. Mean averages of reduction in pain was 3.07 on the visual analog scale and 4.87 for worst pain, because we scored people both for their average pain levels and their worst pain levels. What we actually saw was a variation between some people having no pain relief at all, some people having a moderate degree of pain relief, and some people going even from very high levels of pain to absolutely pain-free. But on the averages, that's how it pans out. So what we propose is a placebo-controlled, randomised, double-blind trial, and to recruit people with MS via their MS specialist nurses, which would be within the NHS. So for this trial, we're going to need to seek research and ethics approval from the NHS. And this needs to take into account any side effects or risks that there are to APS therapy, which doesn't include your head exploding. It also includes things like thinking about how people can continue treatment if they find it useful, and whether people can enter the treatment group if they've been on the placebo group. So we need our participants to have MS, to be between the ages of 18 and 79, to have pain which is not primarily being caused by spasm or spasticity, and not to have any of the contraindications, which would mean it wouldn't be safe for them to participate in doing APS therapy. In order to power our study effectively, we're going to use G-Power software in order to make sure that we recruit enough participants. And we will be assisted and supervised by the University of Bedfordshire to make sure that the study is conducted well. So we're going to apply for funding to request the manufacturers to manufacture 10 placebo machines, which will operate in exactly the same way as the normal treating machines, so that effective blinding can be done. The participants, the research assistants and the principal investigators need to be blinded, and the participants will, once they've been recruited, have a machine couriered to them and have a teaching session using Skype, FaceTime, WhatsApp or some other video calling service, and then have a contact with the teacher once a week. The MS nurses will use the brief pain inventory as an outcome measure, which is a validated outcome measure, and the nice thing about the brief pain inventory is that it not only measures numerical rating of pain, but it also looks at the impact of pain on people's sleep, on their life, on their relationships, on their work, so you can get more qualitative and quantitative data from it. We would like to analyse the results using t-testing, and again the University of Bedfordshire will be supporting. And as we conclude and discuss, we hope to be able to investigate whether the anecdotal and previous research findings in fact have any clinical veracity behind them, and we hope to be able to contribute to the body of knowledge in terms of pain and in particular in multiple sclerosis. Thank you very much.